Well, I think a lot of the consumer-based wearables and even some medical devices, the data just disappears from the patient and goes into the cloud, or in some cases into the electronic medical record, and in other cases it's just stored and owned by the device company, whether it's a activity monitor or a sleep device or other things. And the patient doesn't really, in some cases will get feedback, like I think health dashboards are very important for patients to understand this data and to visualize this data, but they don't understand that they no longer own that data. And I think that's a potential problem, particularly when the data is sold to third parties like advertisers. And another problem is, and perhaps I think you may have even interviewed Hugo Campos and his issues with the company that made his defibrillator, implanted defibrillator. He really fought for a long time to get the data back because the data was going, first of all, to the company, and second of all, to his physician, but he never saw it. So he didn't know what triggered the defibrillator in his lifestyle that it could change to reduce the number of times it triggered due to his heart disease. So I think patients need to know where the data is, who owns it, and how they can get access to it to improve their health. It's very important that I think the data, particularly if it's going to be used for clinical purposes, and fit into the physician workflow somehow, that it be interoperable, which means it has to have some kind of standards. So a lot of consumer-based devices were never intended to be used for clinical purposes, so they're not always standardized the way they should be, like what's a step and what does that mean? And is a wearable giving you accurate data about heart rate, for instance, or is it 10 or 20% off, as has been noted in some studies? So I think it's important that it be standardized, or that we know the range of error, at least in it. So there's a real distinction, I think, between consumer-based devices and medical-grade devices that patients use. And obviously the medical-grade devices have to be standardized and have to be able to feed that data into a meaningful way to providers. Consumer devices aren't there yet, but I think they're improving. There are a couple things that continue with, or help me continue to be passionate about this field. One is the amount of innovation that's going on. There's always something new. Now, not to be distracted by the bright, shiny objects that are just new for new's sake, but I think the ones that have potential for health, and then the progression from the new stuff actually being demonstrated as useful and effective in improving health. One example that I gave yesterday is the asthma inhalers that are now digital, and the opportunity that gives for more accurate data instead of a patient needing to recall monthly or write down how often they use the inhaler versus the maintenance inhaler versus the rescue inhaler. They can really know exactly. And things like adding GPS to that app, then they know, well, I ended up using my rescue inhaler while I was this location, or when there was a high pollen count, and maybe I should avoid that situation in the future. So I think things like that have real evidence behind them excite me too. So I think we're moving it, beyond the bright shiny object phase to real change in healthcare.